All right, I want to bring in now Nkateko Ndala-Magoro, and she is a counseling psychologist at the South African Depression and Anxiety Group, better known as SADAG. We were in conversation with her earlier on. It didn't quite work out with regards to technology, but she's back now via Zoom. Nkateko, thank you very much indeed for coming back on. Good afternoon to you.
Good afternoon, and thank you again for having me back. And I believe it's a very important subject that we have embarked on, and that it's good that the SABC gives airtime to this subject, as we have already heard that it affects a lot of people, especially due to the pandemic. So thank you very much, Ben, for having me.
Yeah, no, it's great, and thanks for taking the opportunity. COVID-19 throws in a new dynamic, doesn't it? And I guess being at peace with the disease once you contract it, being strong in mind so that you can fight it. But the fear of the unknown is strong, isn't it? How can we best deal with this disease mentally? What sort of advice do you have for those who have contracted the virus and are struggling mentally?
Sure. I think one of the biggest things to note is that stress contributes negatively on our physical health. So most people think it's the other way around. It's the physical and then the mental. But the mental health aspect affects us very negatively on the physical aspect. So it's to really calm down. And I think here in South Africa, we are very fortunate in the fact that our recovery rates have been as high as above 80%, which means that people can look at the many case studies to see how other people have recovered and take those steps by breathing in, by calming down and not being overly anxious or panicking. I mean, recently I had just admitted somebody who thought that they might have contracted COVID-19 and they were panicking and they got ill, physically ill, because of the thought of just contracting COVID-19, even though they did not test positive. So our mental health has got a very big role in playing into our physical health.
And we're still learning so much more with regards to the long-term effects of COVID-19. The media sometimes refers to people who have recovered but still going through these issues as long haulers, and talking about depression, brain fog, battling with simple things like word recall. Those kind of issues are being looked at by scientists and learning more about this. So we'll put that one side. Those are adults that are going through those mainly. It's hard enough for you and I as adults to navigate through this uncertainty. It's such an uncomfortable psychological state. How on earth do we expect children to cope?
Sure. And I think, remember, children learn from us adults. So how we cope is how children are also going to cope with the pandemic. So if we are overly anxious, if we are irritable, if we are not checking out our mental health, we then, children take from whatever we are modeling to them. So if we are not modeling being healthy or coping with the COVID-19 pandemic in a healthy way, they're also going to absorb that. People are quite naive. Parents or adults in the lives of children are quite naive to think that because children do not yet have the verbal articulation of what they are going through or cannot express what they are feeling and what is going on, therefore they don't feel whatever they are unable to articulate. But children are sponges, so they learn from their world in terms of what is going on in their world, and they take that and they internalize it, and then they in turn say, this is the way in which we are supposed to be coping with our mental illness or our shock or our anxiety or our fears. But if we as adults in their lives as parents allay those fears in a healthy way by either going to the gym, if I feel stressed and I feel anxious, or eating well, or making sure that I've got my supplements to supplement for my health. Therefore, children are able to see that this is manageable, because in the home environment or wherever they are, be it in school or in social interactions, it is also projected in that way. So we need to be careful in how we word this pandemic to children.
Right.
And not to be ignorant, and to teach them about the dangers and the precautionary measures and the sanitization and washing of hands and mask putting and social distancing. It's not to say that we should be ignorant, but we should also have our mental health in check so that their own mental health is healthy, because they mimic us in everything that we do.
You know, with regards to, I fully understand that acute mental issues, you need to seek professional help. But what about this holistic approach that people are talking about with regards to spirituality, with regards to physical well-being, nutrition, etc.? Talk to us about those various elements and how it can help in terms of mental health issues.
That is very much important. And as you have rightly pointed, holistic, because as human beings, we are not just a part of ourselves. You know, we are not just the psyche or just the soul or just the physical. We are whole human beings. And most of the time when one part is not functioning well, it also affects other parts. So the holistic in, some people, they get solace. And I like even saying to my students, sometimes psychology monopolizes mental wellness. And it's not only in psychology that we find mental health. It's in other spaces as well. It's in support system. It's in families. It's in our churches. It's in our support groups. Finding an activity that calms a person down, be it in the arts, body movement, drumming, writing, singing or listening to music. So this holistic approach is very important. Earlier on, I just talked about exercise and how very important exercise is to be able to regulate our emotions. Because what happens when we exercise, there's hormones such as endorphins, which are feel-good hormones that get excreted, which then also means that we calm down, and in us breathing in deeply the fresh air, we clear our bloodstream of cortisol, which is a stress hormone, which in excess, it can cause damage to our psyche, to our mental health, and also to our physical health. So the holistic approach it's not, we cannot undermine it. And I think in the South African context, we are even much more privileged that we acknowledge this holistic approach, because psychology is quite a Western phenomenon, but we as psychologists that work in a South African context are often understanding that for us to be able to link up with people, to be able to connect with our people, we need to also bring in that holistic approach into the therapeutic space.
Speaking about linking up with people, the support structure, how important is it to have people that you can talk to? I was just speaking to someone earlier this morning, and she was telling me about, confiding in her husband, who is her best friend, because you don't know who you can trust anymore, pouring out your heart, talking about your issues. Talk to us about having that solid support structure with regards to aiding in the healing process.
Support is very important. I cannot stress that more, but I also want us to be careful in terms of what kind of support are we getting. It must be a positive, non-judgmental, and consistent support. If a support system, we're saying that a person needs to be supported in the home or in the family just because they belong to that family, we are missing the point. It should be, if they are going to a family, the family needs to understand their condition, they need to accept it, they need not judge them, they need not make it to be taboo or make it strange and make them think that or feel that they are crazy or out of line or need to snap out of it. So we need to really sift when we're talking about support to say what kind of support are we talking to. We offer here at Pretoria Psychologists, we offer free monthly support groups, and because of COVID-19 they've been online for a while, and we're only going to face-to-face or the physical in November. And one person was saying, growing up in a black family, whenever you try to express your emotions, you are told to shut up, you are told, you are a child, what do you have to say? And she was very grateful for a platform such as what we have created of a support group, a free support group, to be able to just express herself in a non-judgmental environment. And here she is in a family environment. She was unable to speak about her emotions, and which means then it's not a safe space for her to be able to speak about. But the person that you were talking to, whose husband is able to listen and is a best friend, is not judgmental. That we will call a support system, or even redefining what is family or support by maybe coming to a support group and saying, my own family does not understand, or my own friends or my own colleagues, they don't understand, but in here I feel comfortable, I feel confident that I'm not judged, because maybe we are all going through the same thing, or even we're going through different things, but you are able to listen in a non-judgmental way.
Nkateko, many people are experiencing at least some type of trauma during this lockdown, be it mild or severe. This might seem as a bit of a left field question, but should you be concerned if you are not feeling anxious or worried about the future at this stage?
Not necessarily. I think different people have got reservoirs, in terms of their own emotional reservoir. You might find that in the years of plenty, I will just put it such, in the 2019 or preceding the COVID pandemic, people had built resilience, and resilience is very, very important. It's a very important phenomenon, and I've talked about it on our YouTube channel last month. Being resilient, because it helps us in times like this, where everybody's caving in, where everybody's anxious, depressed, not knowing what direction should they be taking, and so on. But because people have built resilience in the time of plenty, when a time like this hit, they are, at peace, they are settled because of that emotional reservoir that they have built. So it's not strange that somebody can be calm and they are not worried, even if they are retrenched. In my own family, there are a couple of retrenchments, there were a couple of deaths, but we were settled, being at peace, because we have built that resilience and that support of each other. So I think in the year of plenty, it depends what you have done, what you have fed your mind with. And I'm not judging those people who are anxious, who are panicking, who do not know what to do at this time and are suffering from mental illness, or it's exacerbated. It's also because of unexpected and other compounding, experiences that they have that have made them to be where they are. So, but then I'm saying that to a person who is not highly anxious, who is not suffering from a mental health illness, don't think that you are left behind and you should be suffering from mental health illness. It's possible that, you've got good support, your spiritual life is intact, there's a number of things that build resilience in such a way that by the time a year of lack comes, it does not take everything. We still have some resources to be able to take from to support us in a time like this.
There, again, you're talking about that holistic approach to mental health. Nkateko Ndala-Magoro, we thank you very much indeed for your time. It's such important input during this time in World Mental Health Day. No doubt we'll have you back on the program, because I think this needs to be an ongoing conversation dealing with the various aspects of mental health. Thank you very much indeed. God bless. Goodbye.
Absolutely. I agree. God bless you too. Thank you very much to you and the viewers.
All right. There you go. Nkateko Ndala-Magoro, SADAG's counseling psychologist.